Hello, everybody. My name is Simon Damalash, and I am a student in the Data Analytics course here at Texas Tech University Health Sciences Center. And for my final project, I decided to do it over gastrointestinal diseases. And yeah, I'm so grateful you all could join me today, and let's get started. Some background information about gastrointestinal diseases before we get into the rest of the project. Gastrointestinal diseases refer to any illness of the gastrointestinal tract, such as the stomach, small and large intestine, and the pancreas. Some common gastrointestinal diseases include IBS, that's short for irritable bowel syndrome, GERD, which is an abbreviation for gastroesophageal reflux disease, and gallstones. Gastrointestinal diseases affect around 60 to 70 million people in the United States. And the reason I chose to talk about gastrointestinal diseases here is because I personally experienced the serious effects of them in my life, as I have a sister who suffers from IBS and she can't eat a variety of normal foods, unfortunately, because of the condition. And both my father and grandpa on my mother's side contracted H. pylori several years ago, and I saw how they were affected significantly. And it really made me want to research and understand more about how these diseases came about and find solutions to fix them. Okay, some aims and objectives. The aim of this project is to analyze the data of people with different kinds of gastrointestinal diseases and look for correlations between potential risk factors of a person's family history of gastrointestinal diseases and their chances of contracting H. pylori. Objectives here are to identify potential risk factors for gastrointestinal diseases across the dataset based on looking at relationships and statistical analysis of these specific factors. Okay, some methods that were used. The data source I use for this project was imported from the website Kaggle, and I decided to rename it to D1 based on the first letter of my last name, which is Damalash. And after I loaded the data into R, I then had to calculate the mean values of the variables, family history, and H. pylori status. In this case, H. pylori status is the dependent variable here, and family history is the independent variable. And using the mean values of family history and H. pylori status, I then had to find the standard deviation values of each variable by using the function sd_d1 score family history and sd_d1 H. pylori status. Following this, I then had to use the chi-square test function in RStudio to perform a chi-square test and find the p-values and see if there was a strong relationship between both variables here. And the reason I use the chi-square test here is because both family history and H. pylori status are categorical variables, and chi-square tests are known for being highly accurate for testing the relationship between categorical variables. Okay, so some of the results. For family history, I got a calculated mean of about 0.5010471. And seeing as how family history is a categorical variable, so proportions value would be equal to the mean value. So the proportion here is also be 0.5010471. And the calculated standard deviation value I got here was 0.50000081. And for H. pylori status, the calculated mean I got was around 0.4997382. And also, H. pylori status is a categorical variable, so the proportion value would be similar to the mean. So proportion value here is also be 0.4997382. And the standard deviation value I got from here was 0.50000071. And following that, when I did the chi-square test value for both variables, I got a p-value of around 0.08207 with a confidence interval of about 95%. Okay, to the conclusion. Based on the results data I got, I concluded that there is a weak association between having a family history of gastrointestinal disease and the probability of having H. pylori, seen as how the standard deviation values for both the variables H. pylori status and family history were both zero point 0.5, and the p-value was around 0.0827, which is a value that's greater than 0.05. And this indicates that there is not sufficient evidence to determine if significant difference exists here between the two variables. Based on this, for the future, I think there needs to be more research studies and projects implemented to determine the connections between gastrointestinal diseases such as H. pylori and genetic factors, as I really think this could help discover a long-term cure for these diseases and also allow healthcare workers to be able to better help patients that deal with these conditions and provide long-term solutions that will be beneficial for everyone that suffers with this. Okay, that's my presentation. I thank you all for tuning in and listening, and I hope you enjoyed this. Thank you all.